Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Amy Goodrow. Thank you so much for being here, Amy.
Thanks for inviting me.
You're welcome. Okay, so today we're talking about surgical services at Covenant. So how have things changed for surgical teams during this pandemic, Amy?
Well, I think quite like much of the rest of the world, we have had to adapt, and then we've changed things and had to adapt again. Everything is evolving current state, and patient safety has always been a top priority as Covenant. Takes care of our patients. We're a high reliability organization, and we're constantly trying to change our process to do better. I think one of the biggest things for us during this current time is we've had to implement a lot of different things, such as with our waiting rooms, in a lot of our procedural areas. Patients coming into our facility are checking in, and for instance, our endo space where we do our colonoscopies and screenings, where patients would typically have a seat in the waiting room, we are taking them directly back. We're trying to minimize and keep them safe as well. But we're finding that a lot of these things that we've implemented and the changes we've made are sustainable things that we really do think make a positive change to healthcare overall.
Oh, that sounds good. That sounds great for patients. We'd like to hear that. So tell us about robotic surgery and some of the benefits to patients with robotic surgery.
Yes, so these surgical robots, they are allowing for the most complete complex surgeries to be completed with accuracy, even in the most hard to reach places. It's a minimally invasive approach, and they're smaller incisions, so patients are typically having less pain, and they're also having a quicker recovery by having this done.
Wow, are there some other specialty surgeries that Covenant has for patients as well?
Oh, yeah. So we have general surgery, gynecology, urology. So when you think of like men's and women's reproductive, cancer surgeries, weight loss surgeries, things like hernias, gallbladders, appendix, a lot of the common surgeries patients need. These are the type of specialties that we currently do. And then outside of robotics, we do have other specialties too.
So for patients who have surgeries coming up, they may be a little leery. What would you tell them about patient safety, just to put their minds at ease?
Yeah, I think one of the biggest things is for patients to know they're not alone. A lot of the things that they're experiencing or feeling, they're very similar for the care provider and the patients. I've seen the investment and the dedication that has happened from the strong team and what that can bring both inside and outside of Covenant. So as an organization, I think that looking at everything from a patient's eyes and not just in our own silos or our own specialties, we're able to make a proactive approach in the way that we deliver care and ensure that the care is safe during a time when many people have a lot of questions, and providers as well. Knowing that the community helped take care of us during the past few months, we want them to know that we're here to safely resume taking care of the community.
That sounds good. Thank you so much for joining us today, Amy. We appreciate you being here.
Absolutely. Thank you.
You're welcome. If you'd like any additional information on today's topic, just head on over to the hot links page on WNEM.com.